Hi, everyone. Sorry for the slight delay in starting this webinar today. I hope that someone from our technical team could just confirm if this is now live and everything's working.
This is live, Stuart. Go ahead, please.
Great, thanks very much. Hi, everyone. Good morning or good afternoon, good evening. My name is Stuart Cameron. I am thematic lead on equity and inclusion at the Secretariat of the Global Partnership for Education. I'm very happy to be here today. I want to warmly welcome everyone to this session. Thank you very much for coming today. The goal of this session is to give a preview of the report, Ready to Learn and Thrive, School Health and Nutrition Around the World, which has been developed by UNESCO, UNICEF, WFP, FAO, GPE, and the WHO, with support from the Research Consortium for School Health and Nutrition, the UN Nutrition Secretariat, and the World Bank. And our speakers in this session are going to highlight opportunities to ensure all school-aged children and adolescents can benefit from the integrated programs they need. And we're also going to be showcasing multi-sectoral approaches to school health and nutrition in practice and exploring how the findings can contribute to the work of the initiatives of the School Meals Coalition. So we're going to be starting with some welcome remarks and a preview of the report. We'll then move to our stakeholder dialogue, where we'll be hearing some cases of integrated school health and nutrition programming. We'll be hearing from some great speakers today. We've got Eda Bone, who is Deputy Executive Director of the Department of Formal Education and Schools in the Ministry of Education, Arts and Culture in Namibia. And we'll also be hearing from Inga Vervloosem, Chief of Education for UNICEF in Bamako, Mali. We'll then have an opportunity for audience discussion and invite our speakers to respond to questions from the audience. And we'll be ending today's session by inviting Carmen Bourbano of the World Food Programme to talk about ways forward. I'd like to ask you today to share your questions and comments through the Zoom Q&A button, which you should see towards the bottom of your screen. And there will also be an opportunity at the end of the stakeholder dialogue to take the floor and make comments or ask questions out loud. Please use the raise hand button at that stage if you want to do that. So with that, I'd now like to hand the floor to Christopher Castle, who's Chief of the Section of Health and Education at UNESCO, and ask him to take the floor and give us some welcoming remarks and introduce the new report.
Thanks very much, Stuart. Ladies and gentlemen, my colleague and friend Eda Bone from the Namibian Ministry of Education and many other friends, partners, and colleagues. It's a great delight to join you in this session on school health and nutrition. I think we all are aware that health, including good nutrition, are key determinants of learning, but many boys and girls can simply not go to school or take full advantage of education opportunities because of ill health, hunger, and marginalization. And of course, the challenge is bigger today than ever. School closures during COVID, which affected more than 1.5 billion students in 2020, intensified the learning crisis. And we know that 70% of students in low and middle income countries cannot read a simple story by the age of 10. In addition, early marriage, early pregnancy, and mental health issues have increased in many countries. Even before the pandemic, 73 million children were going to school hungry, and now the global food crisis is pushing millions of additional children into hunger and poverty, and denying them their right to education. Effective school health and nutrition programs represent an affordable and practical and effective response. As you'll hear today in this session, there are many ways in which schools can protect and promote learners' health so that they can grow, learn, and thrive. You will hear highlights from an upcoming global report that Stuart mentioned on school health and nutrition around the world that presents data on how countries invest in their learners through school health. A comprehensive approach includes the provision of school meals and other health and nutrition services such as vaccinations, deworming, and psychosocial support, as well as health education that provides the knowledge and skills for learners to lead healthy lives and safe learning environments that promote health and well-being. In fact, the report tells us that all these elements need to be combined for learners to make the most of their education. So there's a synergy across all of these things. At the end of the Transforming Education Summit on September 19th, we heard the Secretary General's vision statement highlight how critical it is to support learners' nutrition physical and mental health, including through the expansion of school counseling and school meals programs. We at UNESCO are also convinced that learners' health and well-being are a cornerstone of the renewed vision for the education we need and must have. But clearly, the education sector can't achieve this vision alone. Addressing the needs of learners holistically requires active engagement from different sectors and strong partnerships. A crucial part of the transformation, then, is rooted in improving how education systems interact with health, social protection, and food systems. For this reason, UNESCO is very proud to have joined the School Meals Coalition. Only by aligning and stepping up our efforts together will we be able to ensure that all school children have access to the comprehensive programs they need, including quality school meals. The report, Ready to Learn and Thrive, School Health and Nutrition Around the World, demonstrates that partnerships and collaboration what they can achieve in the field of data. It will be published by UNESCO, UNICEF, and WFP, as Stuart mentioned, and has been developed by the partners of the School Health and Nutrition Interagency Group, which includes WHO, FAO, GPE, the World Bank, with the support of the Research Consortium for School Health and Nutrition and the UN Nutrition Secretariat. And many other partners and country experts were engaged in the production of this report. So our hope is that this new report can contribute to inform the work of the partners of the School Meals Coalition. To give us a sense of what this is all about, we have a short video for you, and then my colleague Emily Sedonner, who's led the development of the report, will give you a preview of its highlights. Thanks very much for joining us.
School is so much more than a place of learning. It's a lifeline to nutrition, health, and physical and mental well-being for children and adolescents. COVID-19 school closures not only affected children's education, it also left over 370 million children without essential school-based healthcare, nutrition, protection, psychosocial support, and health literacy services when they needed it most. As schools have reopened, we must ensure all learners access to school-based health and nutrition programs.
ខ្ញុំមានអារម្មណ៍សប្បាយចិត្តព្រោះខ្ញុំបានញ៉ាំអាហារនៅសាលារៀនជួបជុំជាមួយមិត្តភ័ក្តិរបស់ខ្ញុំ
Without them, mental health, poverty, and malnutrition are made worse for millions of the world's poorest children. When children are well nourished, they have better health and well-being, stay in school longer, and will ultimately have more opportunities to escape poverty and thrive. To protect every child's right to learn, we need to work together and invest in the health, well-being, and nutrition of all school children.
inkuru nasomye irashimishije ku bijyanye n'indyo yuzuye.
Together, from principals and teachers to government officials, parents and partners, we can give learners the opportunity to access the learning they need and the nutrition, health and protection they deserve.
Ukuntu mbona akazoza kanje n'akabandi banyeshuri bagenzi banje nuko dufungura neza tukagira ubuzima bwiza kandi turabona yuko aho ku rugero tugezeko rurashimishije.
We must ensure every child's right to learn, survive and thrive. For every learner, for every school, a healthy start.
This is a nice video, I think, to get us into the topic of integrated programming. So colleagues, ladies and gentlemen, it's a great honor for me to be discussing today with colleagues from UNICEF, the World Food Programme and the Global Partnership for Education, the transformative power of school health and nutrition, and to have the opportunity to share with you some highlights of the upcoming report, Ready to Learn and Thrive, School Health and Nutrition Around the World. This is a collective effort. The School Health and Nutrition Interagency Group, which includes UNESCO, UNICEF, WFP, as well as FAO, WHO, GPE, and the World Bank, has come together with many partners, including the Research Consortium for School Health and Nutrition and the UN Nutrition Secretariat, to develop this report. I'm today representing this group of agencies and partners that are poised to step up school health and nutrition so that all children can learn and thrive. Many more partners were engaged, and many of them are with us today. So thank you so much for joining. This report is the first that brings together the existing data on school health and nutrition, it draws on more than 40 data sets, an extensive literature review, and contributions from experts and practitioners in the field. The process of developing the report, therefore, has highlighted the wealth of data that is available already, but it's also highlighted significant gaps in data availability, comparability, and quality. So, moving forward, generating reliable, comparable, and timely data on policy and implementation, as well as on impact, will be very critical to assess progress and enhance programming. And I'm glad that the day today will give you also an opportunity to hear more about new initiatives to address this gap. But for now, I'd like to leave you with 6 key messages that encourage action to improve, scale, and sustain school health and nutrition policies and programs around the world, and ultimately to improve the well-being of all learners. So the first message is that the health and nutrition of learners are key determinants of education outcomes and an integral part of quality education. Healthy, well-nourished children and adolescents learn better and are more likely to lead healthy and productive lives. School health and nutrition programs are an effective and feasible way to improve both participation and the learning, and to optimize investments in education. This is why they are so powerful. And we have some statistics here that you can see in the slide. For instance, when water and sanitation services are provided in school, we can see a 21 to 61% reduction in absenteeism in low-income countries. This is about participation. And when providing school meals, the enrollment and attendance rates increase by 9 and 8% respectively. These numbers show why health and nutrition need to be a priority in the efforts to recover from the pandemic and to promote more inclusive education systems. And this is the second message. They're actually very good news. Almost every country in the world, 90%, implements some sort of school health and nutrition program today. We will hear in a few minutes about successful examples from Namibia and West Africa, where countries are already working across sectors to implement these programs. But what we can see here is that many countries are already implementing interventions at scale. For instance, more than 100 countries are already implementing school-based vaccination programs in schools. And more than 450 million school-age children are dewormed every year in schools in low and middle-income countries. Almost every country in the world implements some form of health and well-being education in its curriculum. We can take the example of comprehensive sexuality education, for instance, that's implemented in 4 countries out of 5. Many countries have committed to delivering health and nutrition education. However, the report shows that the quality of delivery is a challenge in many instances, and countries are taking different approaches to implement health education. Finally, and that's something this audience is very well aware of, school feeding programs are the world's most extensive social safety net in the world, providing school meals to almost 1 child out of 2 in primary education. This is very promising. However, and this is the third message, much more needs to be done. Many countries are implementing programs already, but we need to strengthen our efforts to ensure that those that need school health and nutrition the most are indeed reached. For instance, as you can see here, we know that only 51% of countries globally provide school-based mental health programs, and only 24% of low-income countries provide these services. For school meals too, the gap is greatest where the need is biggest. While 78% of children in high-income countries receive school meals in school, only 20% of children, girls and boys in low-income countries, have access to these programs. And for other interventions, such as vaccination, we see a similar scenario. So this is a concern. It's a concern because these programs deliver the greatest benefits for the most disadvantaged children. And as we will hear from UNICEF in a few minutes, they can also promote gender equality, increasing girls' access and retention in education, which in turn can reduce the likelihood of early marriage and early pregnancy. So here we have an important issue of equity and inclusion. The fourth message is that this comes with the need to pay more attention to the school environment, which is critical to health and learning. Access to safe water, sanitation, and hand-washing facilities is essential to prevent illness, enable girls to attend during menstruation, and ensure schools remain safe during outbreaks. It's of course also very critical to provide safe, healthy school meals. But almost 1 in 3 schools doesn't have safe water. And again, those children in low-income countries are less likely to attend schools that provide these basic services. There is also clear evidence that children perform better in schools that are safe. But school violence and bullying are common in all countries, and the coverage of prevention programs, again, is low. So, and this is the 5th message of the report, strengthening coverage and impact will require programs that are comprehensive, responsive to the context, and most importantly, sustained over time. Many countries have policies related to school health and nutrition, but the data show that in most countries, these programs are not comprehensive in scope. They don't have what we call a whole school approach to school health and nutrition. If we take the example, for instance, of nutrition, there are untapped opportunities to connect school meals with healthy food environments and nutrition education so that integrated programs can better address the double burden of malnutrition. More attention needs also to be paid to the quality of delivery and to monitoring and evaluating delivery and impact. For that, policy and financial commitments are key. They are necessarily to sustain comprehensive programs. The experience of school feeding actually can show the power of political and financial commitments. As you can see here, now 80% of countries now have a school feeding policy. It's a significant increase over the past decade. And 90% of the cost of the school feeding programs are covered by national government themselves. That allowed the number of children receiving meals to grow between 2013 and 2020 by 9% globally, and even more by 36% in low-income countries. And government invest in these programs because they know they work, just as we are working together to strengthen integrating approaches. Because, and that's the last message I'd like to leave with you, school health programs are feasible and cost-effective investment and benefit multiple sectors. As you can see here, school meals deliver $9 in return for every dollar invested. And programs that address mental health through schools can provide a return on investment of $21.5 for every dollar invested. This means that the resources to improve health of all learners must increase substantially along the funding for education. It's not here about competing for funding, but really leverages resources from different sectors for a better impact. So let me leave you with one final message. The message is clear. Today, children around the world are faced with unprecedented challenges. If we want to increase children's access to school and their ability to learn and their health and well-being, we urgently need to work together to address health and well-being comprehensively. These include ramping up the provision of integrated school health and nutrition programs, and we will hear in a few minutes that this is feasible. Joint initiatives such as the School Meal Coalition are a clear statement of the commitment to align efforts around sectors. They offer unique instruments to transform education and to move forward with better integrated programming. So there's a lot of room for hope. I'd like now to pass the floor to the panelists so that we can hear in practice how this is happening in countries. Thank you very much.
Great. Thank you very much, Emily and Chris, for that very clear presentation. So we're now going to move over, as Emily said, to our panelists, and we'll be starting with Ms. Eda Whitcomb, who is the Deputy Executive Director for the Department of Formal Education and Schools in the Ministry of Education. arts and culture of Namibia. She taps on rich experience gained over the years when she was leading the Directorate of Programs and Quality Assurance from 2010 to 2019. And in this time, she facilitated closer cooperation with the UN agencies around improving various initiatives, including the Namibia School Feeding Program. Ms. Bones serves as the Deputy Chairperson for the National Examination and Assessment Board and as UNESCO Education Commissioner in the National Commission for UNESCO, chairing the Education Committee. And it's particularly useful for us to hear a voice from Namibia, because Namibia co-led the Action Track 1 of the Transforming Education Summit on inclusive, equitable, safe and healthy schools. So I'll hand the floor over now to Eda, and thank you very much.
Thank you so much. I appreciate the opportunity given to Namibia to take part in this webinar, and also to share our experiences in the country since independence. So together with Sylvan, we are trying to navigate the slideshow. So let's move to the next slide. Thank you so much. The overview is here given with the focus on intersectoral collaboration, and whatever we have been doing, we based on the evidence collected, data collected, fact finding in our schools. So let's move on to the next slide that gives an overview of our huge country, over 800,000 square kilometers. And we have altogether 1,947 schools as per school day statistics.
Ed, I'm so sorry to interrupt you, but there's been a request for you to, if possible, get closer to your mic because not everyone can hear you very well.
Okay, is it better now?
I think it's better for me. I hope everyone else can hear better. Yes, I think so. Thank you.
All right, my apology for that. We employ over 30,000 teachers and have over close to 1 million learners. That is 822,000 in schools. Of these, more than 400,000 benefit, that was more than the half of them benefit from school feeding. But how did we get there? I'm now on slide 2. Let's look at the intersectoral collaboration that we were fostering in Namibia. We have been working with all what we call OMAs, organizations, ministries, and agencies in the country, that is cross-sectoral, whether it's gender equality, poverty eradication, social services, health, and so on. Then we also work very actively with our partners in education. These are UNESCO, UNICEF, the World Food Programme, and most of all, also the EU. The EU, the European Union, gives budget support to Namibia. So this gives you an overview of our close collaboration. But there are also other UN agencies that do participate in this dialogue. And we have that UN agency country program that also steers the way forward in our own strategic plans implementation, but also the what we call the Harambee Prosperity Plan implementation. So what are the facts, the background based on the surveys done in the past? That there is a large percentage of learners who are abusing alcohol, 30 to 33%. And then that we do recognize that the young school-going children or learners end up being pregnant. That has been exacerbated with the impact of COVID, where we have more than 3,000 learners falling pregnant, and that also violence is still an issue in the country. If we look in in detail, there are more than 20. Next slide, just click the button, please, Sylvan. You will find that we have done more than 20, 20 studies done that are across the sector, from ECD to pre-primary, primary phase, as well as the secondary phase. Click again. Then we have consolidated all these into our reports, and these are also published. And this gives the strong evidence base for our planning and policy formulation, and then again, implementation. So you see here the global initiative on the out of school children, where we have had the big survey. We have the reworking our Education Act. If you continue, there was also the cost of inaction. If we have heard about the every dollar invested, the investment returns are so much larger, especially from ECD. That includes safety and nutrition. We also measure the school readiness amongst pre-primary learners, and so it continues. We have the an analysis done on the access to inclusive education, but also what was internationally recognized is the study of positive deviant schools in Namibia. So besides that, we have to, have the necessary human resource. And the study that was, through UNICEF facilitated on the mapping and scoping of ICT in education enabled us to take further informed decisions. Our public expenditure review also revealed that there are regions that are able to plow back the resources given in terms of creating more sustainable microsystems in working in implementing school health and school nutrition. That is, with us, it is called the Namibia School Feeding Program. So if you please click further on, then we move to the next slide. These were just all the documents that I was referring to. There has been also in 2019 a study, we stop here, on violence against children in Namibia. So we do see that children are exposed to extreme forms of mental stress. There are those who have who are exposed to physical violence, and so it continues. It was a very detailed report, and based on that, we go back and strengthen our school health, and what we have, the Integrated School Health Task Force. We have a national task force, but we also have regional task forces that respond then and strengthen school-based interventions in mobilizing from the life skills teachers to the teacher counselors, these counseling support groups. So if we reflect on how did we get to this point of collaboration, next slide. We have always had some kind of a school health service that was yet disjointed and fragmented, and with independence, a strong focus on primary health care, then also roped in school and adolescents health programs. So by 2008, we consolidated that all in a national policy for school health. And from that national school health policy, we then developed the training for the integrated school health. And we have come up with a memorandum of understanding with the Ministry of Health and Social Services, which actually enables us to implement our policy and programs across the sector. Next slide. So here's just an overview on the integrated school health, where we do have a strong focus on WASH, that is water, sanitation, hygiene, and sustainable development. The school-based health services, yes, we have annual immunization campaigns and detection and referral programs. We have our national school feeding program in terms of nutrition support that is supported by the World Food Programme, and also other development partner assistance. Continuing with the school safety and child protection with an anti-bullying campaign and substance abuse prevention, as well as support to foster care and children out of school children. Skills-based health education, where we, as of new development, is the sports for development, followed then also by the school health policies. And every policy is to be adapted and contextualized in the various schools and regions. Next slide. So from the integrated school health policy and these observations of the severe impact, or shall we say the severe exposure to violence, our learners' exposure to violence, the children in Namibia, we came up with a national safe schools framework. This framework is based on the Namibia's national safe, the national standards and performance indicators for schools that analyze all key areas of a school and formulate activities and self-assessment in order to create safer schools, as well as enable the school managers, teachers, and communities to play an active role in making schools safer. As part of that, we also had a Keep Me Safe campaign together with the police in the country, nationally, going from to all circuits in schools, campaigning and advocating for safer schools. And of course, also opening all the communication channels for children to be assisted. So now the topic of the day, the school meals and the Namibia school feeding program. As mentioned before, the school feeding started in 1991 in the country, mainly run by that time by the World Food Programme. But as of 1996, the government fully funded the program and was implementing the program throughout the country. Currently, it's over 80 million that is spent from government side on the school feeding. And we have a cabinet approved policy since 2019. So you see, we have been rolling out the program without a policy. The policy came later with the assistance of the World Food Programme. But most significantly is that more than half of all our learners, in actually over 80% of all schools, are benefiting of this one meal a day. And it is a maize blend of maize meal, soya, salt, and sugar to make it more palatable. So that takes me to the next slide, that we are embarking on a program called Homegrown School Feeding. With that, we try to involve local communities, smallholder farmers and producers to produce agricultural produce that then can be acquired by schools and enrich what could easily become a monotonous school meal. And in that process, we do work together with even agriculture, water and forestry, the tertiary institutions, our University of Science and Technology, and others. We have gardening, hydroponics gardens at correctional services, but also the Agronomic Board of Namibia and the Ministry of Trade support school gardens and green projects throughout the country. What is notable also is this is a decentralized program that is able to currently run in 29 schools, but we are intending to scale up, although that comes at a price. But as we learn even of today is that the investment returns cannot be underestimated. So the next slide is taking me to the end. There we go. This is our contribution to the school meals collection event. Thank you.
Thank you very much, Sada, for a fascinating presentation of all of those interconnected interventions and how they're working together. I would now like to invite Inga Vervlozen to take the floor. Inga has 20 years of experience working in the education sector across Africa, both in public and private sector. She has had the privilege of working at regional level as education specialist in the West and Central Africa region, and is currently the Chief of Education for UNICEF in Mali. She enjoys bringing new perspectives to ordinary views, especially through innovation and personal development. Over to you, Inga.
Thank you very much, Stuart. Thank you, Emily and Eda, for these enlightening presentations. So mine will be to shed a bit of light at how we work in West and Central Africa, with a focus mainly on the Sahel region. Next slide, please. Slide. Thank you. So why do we want to venture into a partnership? So the big why, or the vision, is to promote and to protect health, nutrition, and well-being through coordinated strategies, activities, services, to end up with an integrated and sustained approach. Now, the first thing we needed to think about is, what is well-being to us? Yeah. So for us, well-being was really on all the levels: body, mind, and spirit. So physical, psychological, and even socioeconomic conditions are all a part of well-being. And of course, there is no one agency that can do that. So UNICEF works with many agencies, and specifically for school health and nutrition, we at the global level, we signed an agreement with the World Food Program. So we wanted to, looking at the why, to protect and promote health, nutrition, and well-being, we decided to have two specific pillars for the greatest effect and impact, which are, first, integrated approach to wasting, and then secondly, improving access of children to school health and nutrition services. Our region in West and Central Africa immediately picked that up, and we developed a regional resilience building agenda for the Sahel. In this specific presentation, we're going to focus on 3 countries, Mali, Niger, and Chad, and see how they worked on that. So when we look at the two agencies, it's very clear when we look at their mandate, how they can come together and really work on these two pillars that I just mentioned. For WFP, they would focus mainly on the school feeding. And for UNICEF, UNICEF has a lot of different departments. We have WASH, so water and sanitation and hygiene. We have a health department, nutrition, education, social protection, and child protection. And really, when we look at what is needed to implement school health and nutrition, almost all the departments are there. So we focus in this collaboration, we focus on integrated WASH, so water, sanitation, and hygiene, health, of course, nutrition, and then education interventions. For education, we mainly focus on life skills, and I will tell you a bit more about that. Besides the two organizations, so we have a link at the global level, regional, and also at the country level. And at the regional level, the contribution is mainly on technical support, on guidance on standards, and on knowledge management. And of course, at the country level, it is implementation of the programs, documenting that, and fundraising. Next slide, please. Thank you. So where are we with this program, and what was needed to put things in place? So the first thing we needed to do was to have the 3 country teams develop joint work plans and to come up with what is this common package of interventions for school health and nutrition. So across the countries, the different agencies have regular meetings, sometimes more geared towards nutrition, sometimes more geared towards education. We also write joint proposals with WFP and UNICEF. Sometimes it works and sometimes it doesn't work. So there is still a lot of space for improvement. Of course, we also have joint missions, and we include other agencies like UNESCO, for instance, to collaborate in the same activity. And of course, we're very, very closely working with the government and mainly with the Ministry of Education. Next slide. So when we look at the package, so for any collaboration, we need to say, what is it actually that we're going to do together? And here we wanted to have a regional approach. So we wanted to have a bit of harmonization and streamlining across the different countries. So here on the slide, you can see in green the core package, and then gray is more optional. So things that we still add to the mix. We have school feeding. Of course, this is the main task of WFP, and this consists of the regular school feeding, so providing meals in schools, but we also think further. We also think more long-term and about sustainability. What is needed that in the future, we do not need an agency anymore to do school feeding, but how do we build the resilience of the country? Is it through climate change programs? Is it through school gardens? Is it through capacity development, etc., etc.? Then, of course, the basic wash facilities. You cannot speak of health and not have water and sanitation, because you will get so many diseases. So our core package definitely also includes wash, deworming, regular deworming, and then life skills for education. And I would like to say something about these life skills. I loved what Emily said, that the return on investment. For mental health, she says, you invest $1 and you will get $21.50 out of it. And for school feeding, you invest $1, you get $9 out. This also indicates really the power of investing in mental health. And one of the ways that we do that is also through life skills education. For UNICEF, we are using the same framework that UNESCO developed, where you have 4 quadrants and 12 competencies. And life skills or transversal skills are skills like empathy, collaboration, negotiation. So all the competencies that we need as a human being to really thrive in our life. And we truly believe that if we start with those kind of competencies right from early childhood development, it can really build the person and also the mental health of the person. You see other packages, other activities that are part of the package can be other nutrition interventions, also more about menstrual hygiene. We also invest a lot on cash transfer to support the families to get their children to school. Of course, also iron and folic acid distribution. and capacity building, a lot of capacity building for the Board of Governors, for the parents, and for the teachers. Thank you. Next slide. Yeah. Here, what we want to emphasize with this slide is that even though there can be a collaboration, when we work at global or at regional level, we truly need to take into account what is the specificity of the country, and not just have all the activities the same for every country, but really what are the regional priorities, but also what are the priorities for every country themselves. Next slide, please. And to do that, yeah, so in our implementation, we're now 3 years into this collaboration, and we found several challenges. The biggest challenge actually is the limited progress made on joint geographic targeting. And this links a lot with what we're talking about today, data and evidence. Data and evidence is at different levels. It's at the level global and regional to have evidence for policy making, but it's also at the level of implementation. So those are the intricacy when we think through how to really bring agencies together, how to bring sectors together. We need to go really into detail about which school are you really targeting, et cetera, et cetera. And that needs a lot of effort in developing tools for geographical mapping of the different sectors within UNICEF, within WFP, and even as a sector. Secondly, the challenge was to find funding to have really a comprehensive delivery and sustainability. So often you will have funding for a small component, but really to bring everything together, which is, by the way, the biggest strength in it, is still quite a challenge. And then the third challenge, school feeding and school health and nutrition services are not provided systematically. So since funding is not always given, it's quite a challenge to make sure that we can put everything in practice. So when we turn to recommendations, what we can see is, point one, have a tool for geographic mapping, not only at agency level, but also at the government level. Then secondly, to document really what are the challenges, but also what are the lessons learned. Then to develop an investment case, to use that also for the resource mobilization. And of course, as part of the investment case, we also need to link how is the school health and nutrition really helping access to education and the quality and the results of education. And then the last recommendation from our collaboration is to focus on the national priorities and really be very flexible in our setting. Next slide, please. So I thank you for Thank you. So I thank you for the time and the opportunity, and we're here for questions. Thank you.
Thank you so much, Inga and Eda, for those great presentations. Fascinating insights. We have had the Q&A. We've had a number of questions coming in. So if you have any further questions, please feel free to answer them, and our panelists and presenters will be addressing those during the session. Just to note, we've added 5 minutes to this session, and so we're going to be finishing at 20 past the hour. I would like to call now on a number of people who have raised hands to ask questions, starting, if possible, with Donald Bundy. Don, are you there? Donna, I think you're unmuted and you can go ahead and speak. Okay, we seem to be having a little technical hitch there. I'd like to try calling on, in the meantime, on Mohini Venkatesh.
Can you hear me now?
Yes, I can hear you. Would you like to go ahead with your question?
Hi, okay. Sorry about that. Thank you very much for giving me the chance to congratulate UNESCO and the UN Interagency Group on developing the new report, which I think we feel is arguably the most comprehensive report on this topic. And that the key message there that learning depends upon the health and nutrition of the learner in the same way that it also depends on the provision of education, I think is a very key and important message. And I wanted to say that this is a message that's been understood by the School Meals Coalition, and that we from the Research Consortium for School Health and Nutrition have used the report as one of the sources for developing a statement about the current evidence in this area. This statement we prepared as an anchor document for the ministerial meeting of the School Meals Coalition, which is happening in Helsinki next week. And what I wanted to say was that anyone listening to this call, please check the chat. We've put this statement, which is in draft, put this statement on our website, and we would welcome all and any feedback on that. And on our site, we indicate how you can do that. But you can also send us feedback through Q&A if that's more convenient. But I just wanted to say then that the value of the report, I think, is already coming through, and we're already discussing this with the 73 governments that form the School Meals Coalition. Thanks for the opportunity to talk about this.
Thanks very much, Don. And I'd now like to try and pass the floor to Dr. Ronald Olam for a further perspective and question. Ronald.
Thank you so much for selecting me to speak. It's exciting to see what the partners are actually doing to ensure that the learners are safe in school, and many outcomes, including education, is actually well for them. We've already had that school health and nutrition actually improves the school experience for the learners and education outcomes as well. However, I think we cannot exclusively discuss health and nutrition in schools without actually involving the learners themselves, who are the primary stakeholders. If we notice, most of the programs that are being discussed are actually at the partnership level or at the stakeholder levels. But cases where the learners themselves are the primary stakeholders driving their health is something that is not yet coming out as much as possible. I'll give an example for the case of Uganda. I think for the past decades, we've had school health clubs actually playing a very big role in ensuring that the health and nutrition of learners are at par. And an example is the Presidential Initiative on AIDS Strategy for Communication to the Youth that was launched by the President for the HIV/AIDS pandemic. And we saw how it was essential in empowering the youth to take up control over their own health. And even in Uganda, as of now, you find that there are several clubs that are commissioned in school and are actually student-led. Things like Science Club, Young Farmers Club, Food and Nutrition Club. There are many others. And these clubs, you find students themselves going ahead and creating awareness programs, doing poetry, debates, music, dance, and drama, and all this in any attempt to actually improve their own health. I was wondering if there's any way the partners are actually engaging the learners directly during the design and implementation of the policies and the proven interventions that we have heard of. Thank you.
Great, thank you so much for that question. And we'll just invite one more question before going back to the presenters from Mohini Venkatesh. Mohini, are you able to speak?
Hello.
Hello, yes, we can hear you.
Thank you so much, Stuart, and to all the presenters for their description of how integrated school health is playing out in their countries and regions. My question is related to the current context of COVID, conflict and climate crisis, and how we can integrate efforts to deliver school health interventions given this triple C context. So one, how does integrated school health look like in this context? And second, what can governments, what support can they garner from NGOs, multilateral organizations to be fit for responding to the health, well-being, and nutritional needs of learners in this context?
Great, thank you very much. Unfortunately, because of time concerns, it's going to be a little bit difficult to get a response from our presenters. What I would suggest is that perhaps our presenters could use the Q&A box and use the chat box to respond to these important questions, particularly from Mohini and Ronald around these different aspects of school feeding. Because at this stage, I would like to pass the floor to Carmen Bourbano of the World Food Programme to make some closing comments, and perhaps in her closing comments, she might also be able to address some of the considerations that have been raised in our questions, and to give her concluding considerations on this session. Over to you, Carmen.
Thank you so much, Stuart. Can you hear me?
Yes, I can.
Okay, great. Thank you so much to everybody for joining this really interesting session today. And I want to really thank GPE, UNESCO, UNICEF, the government of Namibia, and others for organizing this really important event. I think from the coalition's point of view, and I really enthusiastically second Professor Donald Bundy, who spoke before, this report that has been put together under the leadership of UNESCO, but with the participation of all the agencies that are very much working in this topic, is a really valuable contribution to the knowledge base that really didn't exist before the agencies got together and pooled their data sets and their resources and came up with a first status of the situation, which in and of itself is very valuable. I think today what has been presented from the report through Emily, but also the examples of Namibia, the examples of the WFP UNICEF collaboration in West Africa, is the issue that these programs are very much alive and they are being prioritized by governments around the world. We've seen some examples today from Africa. Also, so my first point is that this is not a theoretical thing. What the report is highlighting is the enormous scale and breadth of the efforts that governments are making all around the world to make these programs a reality. So number one is that this is an agenda that's alive. It's an agenda that's thriving. Even if the pandemic did affect the delivery of these programs, we are encouraged, we are buoyed by the progress that we've seen since 2020, since school closures, and how this agenda has bounced back, particularly in the context of the food system conversation of last year, the education conversation of this year, and in the context of the hunger crisis. One of the participants, one of the people that asked the question mentioned the issue of hunger and food crisis. So the second big message is that these programs and this topic, this conversation is important. It's more important now than ever. And the agencies coming together to support governments like Namibia is what is needed. We need more of that moving forward. We also need, and we heard it from very clearly from the Namibia case, but I think also from the commitment from UNICEF and WFP, that these are really integrated programs that we need to be able to support governments to do. This is not just about one tool or another. It's not just about meals and the plates of children in school, although that is very important and arguably the backbone of a lot of these interventions. But we're talking about water, health, sanitation, vaccination, fortification, nutrition education, and other complementary initiatives that really put together a comprehensive school health and nutrition package. Finally, the message that the learner and the well-being of the learner is crucial for learning and for achievement of SDG 4 indicators, I think cannot be overstated. We need this topic to be at the forefront of discussions and as we move forward in the follow-up of the Transforming Education Summit, where this issue was very much front and center of the discussions. I just want to end, Stuart and colleagues, by also inviting everybody that's listening to the Coalition Week, to these events today and in others, that this is an agenda that is attracting more and more energy and partnerships from the academic world, from the donors that are interested in strategic investments, and really led by government examples and government political will that's being created, like the example of Namibia today clearly tells us. So there's space for everybody. There is contributions that are needed from all partners, from all sectors. And really what we need is to come together to support these governments that are really trying to move forward with comprehensive school health and nutrition policies. If we can do that, if we can manage to support the scale up of these programs at the scale that we really need them to be in low income countries, we would be a long way towards achieving SDG 4, but also many of the other SDGs connected to this issue. Thank you so much for joining us today. Stuart, over to you.
Thank you, Carmen. And thanks very much, everyone. With that, we're going to close the session. You will see that the recording of this session will be released, and the questions are being answered in real time in the Q&A box. So thanks very much to all of our presenters and for everyone who joined us today. And with that, I hope you enjoy the rest of this School Meals Coalition week and have a great day. Thank you, everyone.
Thank you so much.